You're listening to the Mommy Labor Nurse Podcast, episode number 40. Hey guys, happy Monday. If you're listening to this, I am 39 weeks. Maybe I had the baby over the weekend. I don't know, maybe. But it is the 3rd of August and I am due on Friday. But yeah, we'll see. We'll see how this goes. Hopefully I'm recording this and I've already had the baby, but probably not. We'll see. So this week we are doing an episode all about postpartum, okay? Because, well, about to enter that stage of of my life again. And I have a cool guest today. Her name is Karrie Locker, and she is a postpartum nurse. And I met her on Instagram. She is also an influencer, and she does educational stuff on Instagram, but she's a postpartum nurse. So I think that's pretty cool. So she came on the podcast today and we just answered a whole lot of questions about postpartum and what she kind of does as a postpartum nurse, and just kind of answering some frequently asked questions about what your body goes through during postpartum, kind of newborn stuff. And through the episode, I learned that she actually works at a hospital that's very, very similar to the hospital that I currently work at. So we were very familiar kind of like with the same policies and procedures and kind of how things go. So that was pretty cool. So some of the things that we talked about were some of the most common complaints that we see parents face in those first few days after a baby comes: breastfeeding, infant care, wet, dirty diapers, kind of what to look for, what's abnormal, and then bleeding, of course, what's normal versus a vaginal delivery and a C-section. And then we also talked about some must-have items, stuff like that. It was a really good episode. I was really excited to interview her and have her on and just have, and it's nice talking to another nurse every once in a while. So without further ado, let's get into Karrie's episode.
You're listening to the Mommy Labor Nurse Podcast, where we firmly believe in the power of education when it comes to giving birth. Tune in each week as we dive into pregnancy-related topics, expert interviews, and a variety of birth stories. As a reminder, anything you hear on this podcast is not medical advice. Please see mommylabornurse.com/disclaimer for more details. And now, here's your host, educator, registered nurse, and fellow mom, Liesl Teen.
This episode of the Mommy Labor Nurse Podcast was brought to you by Mommy Labor Nurse. Love to sponsor my own episode, guys, and tell you about the stuff that we actually have here at Mommy Labor Nurse to offer you. So one of the things that I think went really well with this episode was my course that I have out called Newborn Basics 101. I came out with this course a few months ago. It was the beginning of May, right when all of the COVID kind of stuff was going on. And I realized that a lot of you guys were getting your newborn basic classes canceled at the hospital. So I decided to make an online version and offer it here. And I know a lot of the classes are still canceled. So it's a really great option if you still have classes canceled near you, at your hospital, or just in addition to some of those hospital classes. Because sometimes you go to those classes and you learn all about what to do, bringing baby home, and then you forget it and there's no real resource, that they give you to follow up. So I like this course because it's all online. You can access it forever and you can just refer back to the course if you have questions. You're like, oh, I don't exactly remember, what this was about or what this was about. So it's pretty cool. It's super long. Currently, there are not videos for it, but we are working on putting videos. So those should be out in a few months. But currently, it's just a text-based course, but it has a lot of info in there. Another cool thing about the course too is I recorded the whole thing as an audio file. So if you are the kind of person that you like to listen to stuff to, learn things, there's an option for it to, it's basically like an ebook. You can just listen to the whole course as well. So yeah, I like to tell people about this class if you are a first-time mom and you are looking for one of those bringing home baby courses, okay? Just kind of everything you need to know about what you need to do when you bring a baby home in newborn care. This is a really, really good course for you. Newborns can totally be scary. I've been there as a first-time mom, like not knowing what the heck I'm doing at all. So this course covers what the American Academy of Pediatrics recommends when caring for your baby. In fact, that's actually where I got most of this information, so you know it's coming from a good source, obviously. You can expect a lot of detailed information, troubleshooting, step-by-step guides, and tips and takeaways. We talk about baby gear and home essentials, what you kind of need at home, newborn characteristics and normalities, breastfeeding a little bit. We dive into formula feeding, tummy time, diapering, bathing, and skincare, how to cut a baby's nails because everybody's really scared of that. And then some other various things like safety and introducing siblings and adjusting to parenthood. I'm really proud of it. I put a lot of work into it and just a lot of hours into it, just writing it up. And I've had a lot of people take it and say that it's fabulous. So if you're interested in this course, head over to mommylabornurse.com/newborn-basics. Okay. And you can use the code podcast listener and you can save 20% on this course. Again, that's mommylabornurse.com/newborn-basics. Use the code podcast listener at checkout and you can save 20%. All right, let's get into today's episode. Hi, Karrie. Welcome to the Mommy Labor Nurse podcast. Thank you so much for being here today.
Thanks for having me. I'm excited.
Yeah. Can you just start by telling our listeners a little bit about yourself and your family, where you're from, what you like to do
Absolutely.
for fun, all that good
stuff.
Yes,
all the good stuff, definitely. So my name's Karrie, and I am a postpartum and nursery nurse here in St. Louis, Missouri, and I'm also a mama to 3 young babies.
Woo!
I know, all of them are under 4 too, so it was boom, 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 and they keep me very, very busy. I feel like I don't even have any other hobbies besides being a mom.
Yeah, so. That is a hobby in and of itself. I was writing out some sort, what was it? My questionnaire for something. And one of the questions was like, what do you like to do for fun and hobbies and stuff? And I'm like, oh, that's really sad. I don't have that
exactly. That's how I feel too. I'm like, is being a mom a hobby? I don't know.
No. All right. Well, guys, we are doing, I guess, we can call it an expert interview. You're an expert in postpartum stuff and all this good stuff. So this episode is going to be all about postpartum issues, postpartum topics. Since you're a postpartum nursery nurse, we're going to be talking about that sort of stuff and caring for patients and what you kind of do and newborn care and all that good stuff. So can you I know you said you're from St. Louis. So can you just start, just tell us kind of like what sort of work you do currently, what kind of care you provide to your patients, how long you've been a postpartum nurse, all that good stuff.
Of course. So I have been a postpartum and nursery nurse for the past 8 years. I currently work in the hospital setting. So I take care of moms about 2 hours after they deliver their baby. Nice. Our labor and delivery unit will kind of turn the patients over to us as the postpartum nurse, and we take care of both the moms and the babies as a couplet. So, one patient for me is the mom and the baby. And usually I have 3 couplets, which is 6 patients. So that's kind of how my day usually goes.
Yeah, that's cool. That's what we do at our current hospital. It's very similar. We have a unit, L&D unit, and they staff L&D, and then there's a postpartum unit and they staff postpartum. I know a lot of hospitals, depends on the area that you're at, but you might have the same nurse who takes care of you. That's like called a LVRP.
Yes. Unit, we have a lot of smaller hospitals that do that.
Same. Cool. Well, what kind of stuff, I guess, so if I was, labor and delivery nurse and I'm turning over my patient, bringing you my patient, what kind of care, I guess, do you provide patients? Like, do you, let's just go from the beginning. Like, what's like the typical, if I drop a patient off, like what kind of stuff are you doing initially? And then thereafter?
So at my hospital, typically the patients will stay in the same room that they delivered in if they had a vaginal delivery. So I won't have to get them readjusted to a new room or anything, which is really nice.
Yeah,
but
that is nice.
Make sure everything is picked up and cleaned up and all that good stuff. And then I will usually go over a little spiel just about kind of how the day or the night is going to go for them, what's in store, try to get them comfortable with me and kind of build that rapport first of all. I ask them how, because typically if you're breastfeeding, they like for you to try to latch baby on within the first hour of life. So by that point, they've already had a feeding with their baby or attempted a feeding with their baby. So I will ask them how feedings are going and see if they need any help in that realm. I will usually do a set of vital signs on both mom and baby, make sure everybody's nice and healthy and doing well. Fundal checks on the mom, of course, which I can go more in depth with, but lots of fun with that. And then for baby, just checking them over and doing my assessment to make sure all is well. So
Very good. Very good. So next question is, what are some of the most common complaints that you see moms, parents face in those first kind of few days when they're with you?
Oh my gosh, the plethora. I've been there 3 times too. So I totally get it. I feel like it totally can help me relate as well. So the most common complaints, of course, pain, which we just either pushed a human out or had one cut out of us. So it's a big deal. It's big stuff. And then usually breastfeeding or nursing comes into play quite a bit too, as far as complaints or things not going as they had planned. I feel like a lot of people think that their milk is supposed to be in on day 1 or 2, and that is not the case. So it's a very frustrating, hard time. And so I just try to be as supportive and positive as I can for them to get them through that struggle at the beginning.
Yeah. Yes, girl, I know.
Yes, I know. Me too. Me too.
It's rough. I'm ready. I'm getting ready to do it again in about 6 weeks. And I'm ready, but I'm also I remember what that first week is like, or I remember what those first couple of days are like. And I'm like, oh gosh.
Yes. Bringing in that milk is so tough sometimes. And your baby wakes up and they want something right now and it is not there yet. It's hard. It's frustrating.
Right. Exactly. And I think that is even touches even more on my whole philosophy of you need to educate, do lots of education beforehand so what to expect. Cause it's
absolutely.
Even and you'll probably agree, as a postpartum nurse and as an L&D nurse, I thought I knew what I was doing, but then when I actually went through it the first time, I was like, I don't know what the heck I'm doing at all.
I am so glad you said that. I felt the exact same way. I'm like, wait, haven't I been a postpartum nurse for years? But yet I don't, it's like I know nothing when it's your own child,
it's
so
totally
crazy. Different.
But that
totally
is
different.
So across the board too. And I've heard that from so many people that it's so personal and you just have to go through it yourself. And do the education. And we're obviously nurses, guys, we teach people how to do this stuff, but until we went through this ourselves, I can't say that I had a super solid, well-rounded, grasp on everything. It's just you teach what you know, but
oh my
rough.
Gosh, I am with you.
I agree. Well, since we're talking about breastfeeding, let's move into the next question. Next one is, do you assist moms with breastfeeding? It sounds like you already do.
Yes. Yes.
And what is kind of your philosophy on breastfeeding?
So my biggest thing with breastfeeding or helping new moms nurse is kind of what I touched on before, is just education first and letting them know. And I have to be repetitive with it too. I have to let them know, even, if they're pumping and trying to supplement and nothing's coming out and they get so discouraged, I'm like, okay, it's all about the signals. We're putting orders in for the milk. It's going to come. We just have to be consistent with it. That is my biggest philosophy, is consistency, because you have to stimulate your breasts frequently and consistently for your milk to come in and for you to have a good supply. So I'm all about that. As far as assisting moms, yes, we have lactation consultants in the hospital that are wonderful. And they usually spend a good 45 minutes to an hour in each patient's room, kind of just assessing their needs, being hands-on, going through information with them. But if they're doing that in a different room and my patient needs help now, then I have to be the one to be there for them. So definitely I love helping them.
Yeah, I love that. And that's exactly how it sounds like we work at the same hospital.
Yeah, I know. That's cool.
Exactly how it is here, that they have, they have us as labor and delivery nurses. We can assist with breastfeeding, and then postpartum nurses, obviously you guys can assist with breastfeeding as well. But then they also employ like real solid lactation consultants.
Yes. And they're incredible. Definitely.
They are. Shout out to all of them.
Absolutely.
All right. Well, let's move into infant care.
Yes.
So what are some of the common things you would say new parents struggle with, like regarding infant care? Not just, we know that there's obviously mom struggles with pain and bleeding and all of this, breastfeeding and all this stuff. But what would you say are some of the more common issues regarding babies, like weight? I know weight. Probably.
Yeah. Weight is definitely one, because babies tend to lose weight when they are, in the hospital, especially those first few days or weeks. That seems to be a real big struggle for parents, and they really tend to focus on that. But it is typical because they got all of the fluids that mom got during labor. Right. So, they're going to be losing some of that weight as well as meconium and whatnot. So the other struggles that I would say would be like jaundice. I know a lot of babies, I would say most babies get jaundice to a certain extent. But if it starts to get to the point where the baby needs lights or phototherapy treatment of some sort, that can be a struggle as well. And something that a lot of moms aren't super educated on, because it's like a what if situation, like, oh, this may happen, but it may not. But then when it does, it can just be very scary or frustrating for them too. So that's something I really like to talk over with a lot of parents. Other than that, really just like skin issues. I feel like I get so many questions on like, oh, my baby's breaking out all of a sudden in a rash. What's going on? And they just have super sensitive skin. So newborn rash and things like that are very common in the newborn period. And then when you get home, it's more of a situation of like, how do I give a bath? And, all the stuff we go through in discharge teaching. So
yeah. Agree on this, all the skin stuff. When I was doing I had like a newborn care online course. And when I was writing that whole section, it was super long because there's so many skin
there
issues
are so many
that pop up. And just, it makes sense, because if you think about where they were, right, they were like in this pool of liquid, and now they're coming out and they have to be in a dry environment, right?
Yeah,
they're not in a liquid environment anymore. So it's understandable that like all of these skin issues come up, along with hormonal issues. There's a lot of like skin hormonal issues that come up too. But it's kind of crazy, like how many skin issues that your baby
could be dealing with. Absolutely. They're like waterproofed inside of mom, and then they come out and we're putting blankets and diapers. So their skin's bound to, break out a little bit. So
For sure. All right. Well, let's talk next about wet and dirty diapers. We're continuing to talk about babies. This is something I think that a lot of moms ask about, like what to look for, what's abnormal, how much, how little, what's going on with that end.
Absolutely. I know. I feel like even myself, like obsess over diapers at the very beginning, especially. So before milk comes in, we typically tell parents that we need one wet and dirty diaper per day of life. So if they're 1 day old, we need one of each, 2 days old, etc. At that point in the hospital, for the most part, it is going to be meconium. Obviously, if you are formula feeding or you're breastfeeding and we get to the point where your milk does come in at a couple days postpartum, then it starts to do what we call transition. The meconium, the first day or two of life, is a black tarry stool, and that is normal, but it freaks a lot of people out.
It does.
It is so sticky and it's hard to get off. So I totally get it. So that is what meconium is, those first couple days of life. And then it transitions over to, if they're formula feeding, it can be a plethora of colors. Typically it will be brown, but it can transition from that green to brown color. And then breastfeeding stools, once your milk does come in and your baby stool does transition, it turns to be like a yellow gold color, which can be very scary for parents as well. And it's also very loose and very seedy. So that's something I make sure I go over with all the moms. And then once your milk comes in or once your baby is taking bottles frequently, we would expect 6 to 8 wet diapers a day.
Yeah. Yeah.
Yeah.
That's about what the current recommendation that we tell patients as well.
Yeah.
Yeah, no, I was just going to say, I like to comment on the smell as well. So like formula fed babies, a lot of people don't realize this is they can have like a little bit smellier diapers, but breastfed babies, their poop does not smell.
I know. I know.
It has that. It does have some sort of an odor, but it's not a foul.
It's like a sweet odor. I don't know. It's like,
it is. It's odd. It's odd. Yeah. So that's just a heads up. If you're a first time mom, that is something at least kind of to look forward to, that it's not like super stinky diapers if you're going to breastfeed it.
Right. And then they start solids at 6 months and that's a whole nother thing.
That's different. Right. Then they definitely get stinky. Not to say that they're not going to be yucky and disgusting and get everywhere. And, they still definitely have blowouts and all that stuff. But it's not gonna be like rank, stinky diapers for a little while until you start solids, unless you're formula feeding. So, all right, cool. Well, let's go back. Let's jump back to mom. So for mom's recovery, I have these, everybody asks me about bleeding. Like, let's talk about bleeding. What bleeding is normal? I've had people DM me pictures and say, is this bleeding normal? Is this
You're like, call your doctor.
Yeah, exactly. That's like my go-to.
Same here.
Let's talk about bleeding and what you would kind of educate mom on in regards to bleeding. If it's different, if you have a vaginal delivery versus a C-section, let's just talk about the bleeding aspect.
Yeah.
Because everybody has that.
Yes, they do. They sure do. And I think that is something I've seen in my DMs as well. People being like, oh, am I supposed to bleed after a C-section? And I'm like, oh yeah, girl, absolutely. So, so you'll bleed after each type of delivery. It doesn't matter how baby came out. Your uterus is still trying to excrete all of that extra blood from delivery. So, the amount of bleeding is pretty heavy early on, especially, I would say, after they are turned over from labor about 2 hours postpartum and I get the patient, they are typically having a decent amount of bleeding because everything is still so fresh and we're doing those fundal checks frequently. So that's pretty normal. But as the days go on while you're in the hospital, it does tend to taper off a little bit. If it's becoming a consistent issue where you're bleeding heavily throughout your stay, that's when we would need to look at making sure there's not like extra placenta left in the uterus where it's not able to fully clamp down. Yes. So that's definitely something we keep an eye on. That's why we do fundal checks so frequently. I know everybody hates them, but there is a reason for that.
There is.
So yes, and it is so necessary. We're trying to go from the size of holding a human being down to the size of a fist with our uterus. So it is going to, put in some work and excrete some blood in doing that. And then I always tell patients with going home too, I like to make it a point that when they go home, because typically on day 2 or 3, 4, whenever they're going home, they may be noticing that their bleeding is very scant or very little. But they've kind of just been in their hospital room or in their bed or just walking around the room, not really doing very much. When they get home, they're more comfortable. So even if you're just walking to your kitchen, then to your bathroom, here, there, and, it can pick up. It goes in ebbs and flows, no pun intended. And, and it can pick up a little bit, but we never want you to get home and be passing like golf ball size clots or bigger. And we also don't want, you would need to call your doctor if that happened. And we also don't want where you're sitting completely still and you just feel that constant trickle. You feel like you're constantly bleeding. And that's the same in the hospital too. I always tell my patients, hey, if you're not shifting your weight or moving around, you're sitting completely still and you feel like something's coming out, just call me. I'd rather come check it and make sure everything is great, before we get to a point where we need to intervene a little bit more postacely.
Yes, agreed. And I know, and there's a lot of different reasons why I guess you can have excess bleeding. And you brought up one good one where there might be an extra piece of placenta or something from delivery in there. And it's basically just your body is still thinking that it needs to provide a blood supply. So it's like, oh, ding, 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 there's something in here. I need to, send more blood, when in fact, nope, there's no baby, nothing in
there. No baby, just a little piece that does not need more
and man,
flow. Exactly.
that'll get you, that'll cause some issues if that's still
absolutely.
So that's definitely a reason, that a fairly common reason, I would say, for like excess bleeding. Another one is like if you have a super severe tear that's, having more of that trickle and you're just, having excess bleeding from that. And another big common one that I tell people is just sometimes your uterus is what we call boggy, and it's just
acne, not right.
It's acne, right? It's just not cramping down. It needs some help cramping down. So
exactly.
Lots of different reasons. All right, let's move on to the next one. So the next one is, what are some of the most common things, like items and just stuff that you wished everyone knew as far as postpartum recovery? Or I guess we can just talk about let's talk about tips first, and then we'll talk about items.
Okay, I have a big tip for a C-section patient. So with postpartum, if you had a C-section, first of all, ask for an abdominal binder if you're not given one. That helped me tremendously after my C-section, and I recommend it to all of my C-section patients. However, I walk into a room all the time and I will see my C-section patients with their binder like up over their abdomen, when in reality, it needs to be down over your hips and over your incision. Because if we have it up on our abdomen, like for the most part, that's going to be shoving all the pressure and all of our organs down onto our incision rather than supporting from the sides and the front. So that is a big tip for abdominal binders with the C-section. Let me think. Other than that, along with that, I do want to mention too, with having your abdominal binder up high on your abdomen, that can actually trap gas, which is something a lot of C-section patients tend to struggle with on days like 2 and 3 postpartum. It kind of just traps all the air in one spot because you have this tight binder from the outside. It doesn't let things move through. So take breaks from your binder too. I kind of just like to recommend it when you're like getting up to the bathroom or walking around and stuff like that. Yeah. And then, other than that, for a vaginal delivery, I know at my hospital we do this, and this is something that I think is wonderful. Each hospital is a little bit different in how they make their ice packs, but I highly recommend using ice packs to help with swelling. We do diaper ice packs. So we actually we peel apart a diaper and put ice in it, and then like use the tabs. I have a whole highlight on my Instagram on it, but you use the tabs to kind of wrap around, and it like forms right to your body. It is so perfect. So
you're
highly
talking
recommend
about like a baby diaper, like
like a baby.
Like you take,
exactly.
Yes, I know what you're I've seen people do that before. That's a very good tip.
Yeah, and you always have it on hand because you have a new baby at home. So even if you're needing it at home, you have everything that you need.
Yes, no, that's a great tip. I'll definitely link that. I mean, I'll link all of your social media and all of that stuff in the show notes page for people to check out. But I'll link that specific highlight for people to check out for that. Because that's a very good tip. And God knows you need that ice and just that relief down there. It can be
it is incredible.
It can be rough the first few days. Yeah. All right, well, let's move on to items. So are there any like must-have items that mom should have on hand, maybe either in the hospital or as we're getting home, first few days, first few weeks of postpartum?
Yeah. So here's the other thing. I don't know what every single hospital sends home. I know the typical stuff that they send home. So I'll kind of just go off of what we send home. What I would recommend having at home, which like I was saying, your hospital will typically send you home with whatever you have left over of this: Dermaplast spray, your Peri bottle. Yes. Your Tux pads, those witch hazel little circle pads. Those are all incredible to have for a vaginal delivery. And then of course the abdominal binder for a C-section patient, as well as the Peri bottle, because you still got to clean up down there. I think it's fun or necessary or nice to have a little like postpartum basket at your toilet. And that way, everything that you need is just right there whenever you need it. And then as far as like things to have in the hospital too, I I don't really think it's necessary for most moms to bring their Haka, but for when you get home, I think a Haka is a great item to have for when your milk comes in, because usually your body will like overproduce to start until it knows what exactly your baby needs to take in.
Right.
So you might as well reap the benefits and collect some extra milk for bottles later on. So I totally recommend the Haka pump. And then so those would all be things I would say to help mama, as well as what I did after my vaginal deliveries is I would sit on my boppy. Like I felt like I would like make my boppy into almost a little donut pillow and sit on that. And it was so incredible. So just a little tip if you have a boppy, which I feel like most people do. So you don't have to run out and buy an extra pillow or something just for you. Other than that, I did want to mention something for baby.
Okay.
It is this little nail file. I always get asked in the hospital about like, when can I trim their nails? When can I trim their nails? And their nails are super flimsy and still attached to their skin a little bit at the tip of their finger. Yeah. So cutting nails is really scary. There is an electric nail filer, like a battery powered one with a built-in light. And it's got all these different like grits on the head. Oh my gosh, it is incredible. I've used it with all 3 of my kids and I recommend it to everybody because you can't make a mistake with it. It's foolproof. So highly recommend one of those.
That is so funny because I had one of those for my dog. And I like, and she passed away a while ago. But like, I'm like, why didn't I just use, it was like for a dog, but I'm like, why? That's so brilliant.
And now they make them for babies. Yeah. Yes. And I have had so many followers be like, oh my gosh, this was the best thing ever. So I always recommend that to my patients. Yes, great. Absolutely.
That's a great tip. I love it. Well, awesome. Well, do you have any just last tips and tricks for mom or for baby, or I guess if we maybe have some dads listening, partners listening.
Dads too. I know. I could go into a whole segment about dads.
That's a whole other episode.
Exactly. I would just say if you are nursing, like I kind of touched on a little bit ago, make sure to utilize your Haka as much as possible because as your milk supply regulates, you won't have as much extra to collect. So definitely reap the benefits while you have a decent amount of milk when it first comes in. And then my other biggest just tip is taking care of yourselves, like the moms. Oh my gosh, you guys come first. I know when baby comes out, I feel like it's everybody's like all about baby. And I know they're cute and they're wonderful, but you have to take care of yourself in order to take care of your baby. So please make sure that you fill your own cup before you go and fill baby's cup, if that makes sense.
Totally makes sense. And I'm totally like a firm believer in that and going to do that. Tenfold this time because I certainly did not do that the first time as much. You just think like everything revolves around baby and I don't even have time to wash my face like I normally would and like do this like I normally would. But like when I think about the stuff, kind of like the self-care stuff that makes me happy, I'm like, this is not that long of my day. And I need to keep this up. Like this is important for my mental health.
Exactly. And that's a whole nother segment too, isn't it? Like, oh my gosh. But even, just hand baby off to your partner and then just taking a shower and painting your nails can make you a whole new woman, like just something for yourself.
Oh my gosh. Yes. Very good. Yes. Tip. Well, Karrie, can you tell our listeners where they can find you? Because I know you're on social media as I am.
Yeah. Yes.
Can you tell them where they can find you?
Absolutely. So my Instagram is Karrie_Locher, and Locher is spelled Locher.
Okay.
And I also have a website called Caring for Postpartum with a K, Caring for Postpartum. Okay. So those are my 2 biggest platforms to come check me out. In my Instagram section, I have an entire highlight section or a highlight reel of all the tips and tricks and segments about each and every topic for postpartum, infant care, motherhood, nursing, pumping, etc. So there are like over 50 highlights of different information you can watch through. Yeah.
I love it. I love those highlights. I love saving stuff there and I love going back to people's highlights and checking, like older stuff that they've saved out. So
exactly. Because I'm like, everybody goes through it at different points. So
oh my gosh,
they can refer to it whenever. Yeah.
I love it. Well, thank you so much for coming on. I think this was a great informal educational episode for anybody about to give birth like myself.
Exactly. There you go.
Well, thanks for coming on.
Thank you so much.
Are you looking for birth education? Did you know that I have 2 fabulous birth courses that are super affordable? Well, I do. Head over to mommylabornurse.com/podcast to take a short quiz to see which birth class is for you. When you purchase either birth course, you'll have full access to it forever. And that means it will never expire and you can access it throughout any stage of your pregnancy or for any subsequent pregnancies that you have. You'll also gain free access to my Facebook group, linked to the class where you can ask questions about your pregnancy, share your birth story after you give birth, read other people's birth stories, and get to know other members who are in the course. There is also a money-back guarantee, so if you are at all unsatisfied with your purchase, please send me an email at hello@mommylabornurse.com for a full refund. There's really no risk to signing up, and I promise you will learn a ton about what's to come when you give birth. As a listener of this podcast, you automatically get 20% off any purchase if you use the code PODCASTLISTENER. I've had tons of moms just like you enter these birth courses and have fabulous, wonderful, empowering births because they feel so much more educated about what's to happen. So if you are at all curious about birth education, again, I encourage you to go to mommylabornurse.com/podcast and use the code PODCASTLISTENER to save 20%. All right, so that is it for this episode of the Mommy Labor Nurse podcast. You probably follow me on Instagram because that's probably where you came from. But if you don't, head over to Instagram and follow me at mommy.labornurse for more. That is certainly where I am most active. I also now have a separate Instagram for just this podcast, so I encourage you to follow my second account at mommylabornurse.podcast as well if you want podcast updates. Again, that is at mommylabornurse.podcast. As always, you guys know that I also have a website where I have tons of articles all about pregnancy, birth, breastfeeding, newborn stuff, and more at www.mommylabornurse.com. I want to hear more from you on how much you love this episode of the podcast or how you think I can improve. So leave me a comment on one of my pictures, send me a DM, or send me an email with all the love. All right, guys, I will see you same time, same place next week.